Good evening, everybody. Thank you very much for attending this session this evening on EMIS Health Live, the new normal. Thank you for your attendance this evening. We have an hour session, which will be providing some oversights to a number of areas that we've been working on, certainly from a pharmacy perspective, in relation to COVID-19. So the topic of today's session is the future of pharmacy post COVID-19, and just an introduction, by way of introduction. My name is Chanel Wright-Shora. I'm EMIS Health Clinical Director for Community Pharmacy. I've been with the company for nearly 12.5 years now, and I have accountability for all the safety of our systems across our live estate, so Proscript Connect and other peripheral services that we offer. I also have a very strong input into the strategic roadmap for our application and just the general direction of travel from an IT perspective for the community pharmacy sector. I'll just hand over to Jason, who's also going to be supporting me this evening. Jason, over to you for your introduction, please.
Thank you, Chanel. So yeah, it's a pleasure to be joining you in your future pharmacy session this evening. I'm the CEO of the Patient platform, and at EMIS Group, and that really consists of two assets. One is patient.info, which is our healthcare content, independent healthcare content website, and of course, Patient Access, the #1 primary care application in the UK. And I look forward to sharing with you just how we're using Patient Access to drive the growing trend of services, clinical services in pharmacy today.
Great, thank you very much, Jason. So, being a contractor myself, I run a pharmacy in North London. I'm very much at the coalface of what's been happening to the pharmacy profession during this unprecedented times and this pandemic that we've been experiencing. So today's agenda really talks about some of the services that we've offered in support of our customers during this period, but also we've looking to hopefully sustain these services going forward so that our pharmacy customers are prepared for any future pandemic situations that may arise, or a second wave of COVID, which has been discussed in the press quite a lot recently. So in terms of our agenda, we're going to be providing you with an overview of what we've done from a COVID-19 perspective. Jason will talk to you about Patient Access, which is EMIS Group's patient-facing app. We'll talk about some of the services that we've actually provided through the app from a pharmacy perspective, and that relates to the professionals piece. So the Patient Access for Professionals is the module that supports community pharmacy. I'll talk to you a little bit about Proscript Connect and some of the enhanced functionality that we've launched over this period of time, and how we will be preparing for the future, and an insight into something called Smart Pharmacies, which is an exciting innovation that we are doing through the Patient Access app. Okay, so in terms of our approach to COVID-19, we've really concentrated on three areas that we felt were necessary for both pharmacists and for their respective patients that they serve. So Pharmacy Access is an application which comprises of two modules. The first module is GP Record Viewer, or GPRV as we abbreviate it to, and the other service is called Medicines Manager. Both of these are unique selling points of our services that we offer for Proscript Connect customers, as it allows our customers to directly talk to an EMIS web surgery, either by looking at the medical record for the patient that's sat on EMIS web, or having the ability to submit an electronic repeat request from Proscript Connect into the workflow of EMIS web. Now, over a period of time, we are fully aware that certain CCGs have clamped down on the repeat requests coming from pharmacy, and that obviously has caused some problems for our customers that have been using the service. That said, we've seen an interesting U-turn in a number of these CCGs, but also an uptake of this service. You're probably very much aware, as I am, that on the day that we had lockdown, or just sort of towards the beginning of the lockdowns when it started, a number of surgeries started to close their doors to patients. A&E was a no-go area for patients, and we found these patients to be visiting our pharmacies in some significant footfall coming through. So we felt that it was important for us to switch these services on and to ensure that we are able to support our customers by supporting patients with their repeat prescriptions. We then did some work on patient access, and Jason will talk to you about some of the areas that we've done. We switched on video consultation and other services through the patient access app for our GP estate. And it was important that we provided the same functionality in the level playing field, and we enabled similar services through video consultation and telephone consultation through the patient access app for patients to book a pharmacy appointment. And finally, probably the one thing that would be the bane of people's life is the connection to the N3 and to spine. So we recognise that the N3 connection to the NHS spine for EPS and other services such as Summary Care Record is a critical component of the community pharmacy setting, and it's important that that service remains 24/7, 365. And the last thing you want is for a broadband connection to go down, and then you have no access to prescriptions and therefore have an impact on serving your patients. So we implemented a service which effectively failed over to a 4G connection, a 4G N3 connection, to enable pharmacies to still continue to operate if there was a problem with their broadband connection, especially during COVID. So, in terms of what do pharmacists expect post-COVID, I'm just going to pass over to Jason, who will provide an overview on some of the areas that we've been working on during COVID and, as the title slide says, after COVID as well. So, Jason, over to you, please. Thank you.
Okay, great. Thank you, Chanel. So if we can move on to the next slide, please. Thank you. Essentially, our mission is about giving patients a single point of access. At EMIS Group, patient access is at the core of our patient-centric strategy, really our approach to digital-first primary care. And it's not just COVID. Our journey started 2 years ago when we decided to rebuild patient access. We call it Patient Access 2.0 internally, and we made sure we did a lot of research because we knew how important it was from the research that patients want the ability to be able to access all of the important components of their healthcare in one place, right? We've seen it in many other applications. People, when they're ordering their food or booking their travel, really like to use one application. People wanted that single point of access. And at the time, we were doing 4 things really well, right? We were the ability for people to read content, see their medical record, book an appointment with a GP, and manage their meds. But what we wanted to do was connect care, because we know that the healthcare market in the UK is hugely fragmented. And what we want to be able to do is empower GPs to be able to refer people into new care settings, but also empower patients to be able to self-refer. And one of the first areas that we decided to extend that booking engine, that booking capability, was in community pharmacy. And we ran a pilot last summer with Day Lewis and rolled out across all of their pharmacies by the end of the year with huge success. And it's really, really important. We've had great feedback, and you know, our focus is very clinically driven. You know, we've got access to over 40 GPs at EMIS Group, but we also have Dr. Sarah Jarvis, MBE, who I'm sure all of you have seen on the TV or the radio during this period. And we have a large group of GPs that are writing a lot of content so as we can enable people to self-care. And that's what's really, really important, is not just the ability for people to be referred or self-refer into different care environments, whether that's a pharmacy appointment, whether that's an appointment with another healthcare professional, such as a physiotherapist. It's really important that users are able to connect to care. And all of this connection leads to the production of data. And that's what's really important as we strive to deliver personalized care. So if you could move on one, please, there, Chanel. So the data-driven care is all about the longitudinal view, all of those data points. So let's take 3 examples so as everyone understands what I mean. Today, when somebody goes into their GP to get their repeat prescription, and they're given that prescription by their GP, when they leave the GP practice, they don't actually know, have they picked up their meds? Are they taking their meds in a concordant manner? Patient access's goal is really to focus the ability to be able to enable patients to be able to order their meds, get the approval from their GP, then inform their nominated pharmacy that those meds have been approved. And I'll explain what that means a little later, kind of touching on the point that Chanel made earlier about the fact that the ability for pharmacies to be able to order meds on behalf of their customer have been taken away. Well, we've come up with a solution to bring that back in a real joined up way with a great CRM. We're also going to be focusing on medical adherence, which I'll touch on a little later. All of this written back to the record to enable patients to establish a new relationship with their GP. Another example, more personal one. I had a bad sports knee injury last year. When I asked my GP for a referral, he gave me one, which was the guys across the road. It didn't suit me or my place of work. Now with patient access, because that same booking engine that we have in pharmacies, I can then go and book a consultant, have a treatment plan, and then that physiotherapist can write all of those notes back to the record, enabling my GP to make one of two decisions. Do I need to go and see a consultant, or can I get back on the field of play? And then finally, sharing clinical content. We know that self-care is hugely important in today's environment. So the ability for GPs to be able to recommend a lot of our clinical content that Dr. Sarah Jarvis's network of authors produce on a daily basis. And just to give you an idea, during the pandemic, we were getting a Google ranking score higher of that than the BBC and the Guardian. So hugely trusted content. But we're not going to stop there. We want people to be able to remote manage. We want people to be able to upload data with their GP, could be their weight, their activity, their blood glucose level, or their blood pressure level, which then enables the GP to manage that patient remotely. Really important for patients who are in isolation, but more importantly, they may be able to refer that patient to another clinical setting, such as a meds review at their local pharmacy. So move on one, please, Chanel. So how are we doing? Pretty good, actually. We're live in over 1,000 pharmacy branches in the UK, mainly Day Lewis, and 900 pharmacies from the Phoenix Group, which is obviously comprised of Newmark and Rowlands, and a number of independents. So, our goal is to get to 5,000 pharmacies over the next 2 to 3 years. As we came out of pilot, we've already produced 25,000 appointments into pharmacies for either minor ailments, services, or PGDs. And that's a pretty good number considering when the pandemic hit, a lot of those face-to-face appointments abruptly came to an end. And what we had to do was pivot really, really fast. And as Chanel mentioned, the first thing we did is we rolled out video for GP practices, but then we introduced video for pharmacy too. And not only video, but we could also enable patients who don't want to use or are not comfortable with video to even book a telephone appointment so as they can connect with their local pharmacy. And when I think about the winners in this COVID period, this very trying time, the ability for people to really understand the concept of community pharmacy delivering clinical services has been one of the standout points for me. And it's one of the reasons why we wanted to connect pharmacy to all of our 10 million patient access users. We're delivering, the last 12 months, we delivered over 11 million GP appointments. We want to be able to deliver millions of appointments into pharmacy, and that's our goal. So if we move on one, please, Chanel. As I mentioned, very, very simple interface. We have great feedback from a lot of our users. If you go to the iOS or the Android store today, we have 4.8 stars out of 5. We know we can do a lot better, and we're continuing to do that. But in this very simple interface, if I click new booking, move on one, please, Chanel. Then what you have is a list of pharmacy services. So in this particular case, my local pharmacy, the pharmacy services that I can avail of are listed. In this case, it's PGDs, but I can also book a pharmacy telephone consultation or a pharmacy video consultation. Move on one, please. We obviously make sure that we fully brief the patient on what the type of booking that they are about to book. Move on one, please. Then, very simply, we, based upon your postcode, we then give you a choice of pharmacies against that service that you've chosen. So then you can easily pick that local pharmacy, choose a date, choose a time like any other on-demand service, but also make sure that we clearly label the fact that there's a price associated with that appointment. In this case, it's a private telephone consultation. So moving on one more, please, Chanel. Very simply, you choose that appointment type, then you pay for it within the application, and that obviously removes a lot of friction from payment and having to take payment, and taking payment in app really drives the ability of people to show up and turn up for that appointment. And we take that payment within the application, and unlike other services, we do not hold on to that money. We make sure that all of the income that's generated from that appointment is on a weekly basis rounded up and sent straight into the bank account of that local pharmacy. And one more, please, Chanel. Then it comes to patient access for professionals. In a basic sense, this is about supply and demand. We've got 10 million users on the demand side, and we are introducing them to pharmacy services. So patient access for professionals is simply a CRM diary management system, except it's been designed specifically for community pharmacy in mind. We worked with a number of community pharmacy, whether independents and multiples, to make sure that we were designing this correctly. So it's built specifically for pharmacy services. What does that mean? It means that the diary management system enables the pharmacy to be able to offer up all of their services, like in the list you saw a couple of slides ago. And essentially it enables the pharmacy to be able to pivot over a number of dimensions. First of all is date and time. Secondly, it's the ability to choose clinicians that they have on their team on that particular day to be able to deliver those services, list all of those services. And finally, the really important one is the ability to manage their consultation rooms. Lots of pharmacies only have one, quite a few pharmacies have 2 consultation rooms, and what it does is it enables the local community pharmacist to be able to manage not only those who are booking a digital appointment, but also the walk-ins, and ultimately make sure that you're not double booking that consultation room, because when people book something on demand, there is an expectation that they will not have to wait very long. And that is what this tool has been designed to make sure that it's really, really easy for the community pharmacy to be able to list their services to that 10 million user base, but also manage all their local neighborhood traffic. And that's patient access for professionals. And I'll hand back to you, Chanel.
Jason, thank you very much for your slides there on what we've been doing, some cracking stuff. Thank you. So just talking about it from a pharmacy perspective, before I move on to the next slide, the calendar booking engine for community pharmacy has started to play a really important part and will continue to play a really important part. With no doubt you're all aware, I'm probably teaching you to, teaching them something that you already know, but pharmacy works very reactively to the workload, and we want to try and manage that workload much better. We know that services is going to play a big part of the new pharmacy contracts or the community pharmacy contractual framework, and there's a number of services both at the moment and going forward which rely upon a patient booking an appointment in order to be seen by a pharmacist. So we've started to change the mindset, which I believe is an important mindset change that pharmacy need to make in terms of managing their workflow through the pharmacy, through an appointment booking system. And we've tested it with private services, but equally this can be used for NHS services as well. So if you want to list your NHS services, such as your medicines use review, although they're going soon, new medicine service, for example, or any other NHS locally commissioned service, you have the ability to promote those services for your pharmacy on the app, and the patient is then able to book an appointment. So some interesting metrics coming out from that to really help. And we are working with NHS England and other organisations to try and support nationally commissioned services such as the GP community pharmacy consultation service, and seeing whether we can offer these services up to those areas for comparison against other methods for referral. Okay, so moving on to the Proscript Connect side of things, you may or may not be aware that we acquired, or EMIS acquired, Pinnacle, which produces and develops software farm outcomes back in March 2020. We felt this was an important move for EMIS Group, because going back to my previous point, the direction of travel for pharmacy is by offering services, and we've tackled this move in a couple of ways. So, by Pharma Outcomes is the market leading products in the community. 80% market share of services go through Pharma Outcomes. It dovetails quite nicely into the ProScript Connect functionality that we want to integrate with, and by doing that, we can then start to integrate the claiming of services and other data capture through the system, but through ProScript Connect. And I'll talk to you a little bit about that in a few moments. We've done that because that's important from a services side. But in order for you to do services, we need to alleviate some of your volume and headaches around the dispensing process. And we've been working on a number of hub and spoke models for community pharmacies, so that we can free up some pharmacy time and your technicians' time to allow you to do these services. So ProScript Connect has been developed in a number of ways to try and support pharmacy through a very torrid time and a very sensitive time during this new contract, but also through some really drastic market changes that we've all seen from a funding perspective. So since we've acquired Pharma Outcomes, we've done some really interesting work and some quick wins to support pharmacy, and hopefully try to support pharmacy through COVID. So the first thing we've done is the integration with SER One Click. So Summary Care Record One Click gives you the ability to view information about the patient. And no doubt you're aware that there was a national service that was announced back in April, where pharmacies were able to offer the pandemic delivery service, but they can only offer that service to those patients that had been flagged as being shielded. So through leveraging the functionality that was already in Pharma Outcomes, we were able to pass through the patient demographics, or we are able to pass through the patient demographics for a patient into Pharma Outcomes to check a summary care record, to see whether the patient is shielded, and for then that pharmacy to decide what they do next, whether it's to contact somebody through the Go Samaritans app, whether it's to do the delivery themselves, or to signpost elsewhere. So we're trying to conform to the service requirements as much as possible, and by doing so, we're then able to start to effectively capture the data through that. So through the patient's record, you're able to access all the services that are available through Pharma Outcomes, and all this is done within a single sign-on of ProScript Connect going into Pharma Outcomes. And once you've signed on once in the morning, for example, then you can access the service as many times as you want, and it will just follow straight through into the Pharma Outcomes landing page and the associated services. We then have a section which will show you the shielded patient check. You click on that, and it will then provide you with a list of reports subsequent to when you've captured the data, that will tell you how many patients you have delivered to, how many claims you can pass through onto NHS BSA, and you have a way of actually keeping an audit, so that if there is a post-verification payment check with NHS BSA, you have the information available through the portal at your fingertips to demonstrate the fact that you've been delivering to those patients personally as a pharmacy. So that's one example of where we've done some nice integration work as a quick win to try and support pharmacy for COVID. Obviously, we're not stopping there. There's probably tons of integration that we've roadmapped for the forthcoming versions of ProScript Connect. However, we do see some quick wins, and obviously the PDS, or the Pandemic Delivery Service, is a key component of that for the here and now. However, we are very quickly approaching the flu season, and the flu season, we want to ensure that we are absolutely supporting our customers from day one. No doubt you are aware that the flu service is probably going to be the largest campaign that certainly community pharmacy will be entertaining. We know that GPs are going to be controlling who walks in through their doors. There's not going to be many surgeries offering drop-in appointments. So I think a number of patients will be looking at other options and avenues to get immunized. And as the catchment criteria for immunization against the flu influenza has increased, we see the footfall also taking a similar effect as well. Therefore, what we want to try and do is, again, using the appointment booking engine, try and streamline and drive some operational efficiencies through the pharmacy by allowing patients to book an appointment. And this can be done in a number of ways. Leveraging patient access is one option. Using facilities that are going to be hopefully being made available to through Pharm Outcomes soon, through pre-consults, where patients are able to fill in early parts of the flu vaccination service and the questions that are asked, and naturally putting it through ProSup Connect. So let's take the first flow, which is the patient access flow. Jason explained to you how the booking engine works, and this will be no different to booking a flu service. So the way it would work is a patient would search for flu vaccinations. It would display to the patient that there are pharmacies in their current locality that are offering a flu vaccination service, whether it's an NHS flu or a private flu service. If it's an NHS flu that the patient books, then a message of that goes to Pharm Outcomes, and it holds it in a pending state for future retrieval. So the information that goes from patient access into Pharm Outcomes is the appointment date and details of the consultation, and that would include some criteria that the patient may have filled in prior to that. You then obviously go into ProSup Connect if you are using ProSup Connect, and then you're able to retrieve the information about the appointment that's been made on patient access, and then have the ability to select the flu service from ProSup Connect, and then that hooks in to Pharm Outcomes, and that will then kickstart the validation of the patient. So the patient that's booked it through patient access will then be validated through the personal demographic service, which is a spine service to ensure that it's the right patient. You undertake the flu service, you capture all the relevant data, that then puts it in a state to be sent for a claim at the end of the month. And then it also has the ability to document that the flu service has been done. That information is then stored in ProSup Connect, and a notification of the flu vaccination that's been administered by that pharmacy is then sent to the relevant prescriber, whether it's an EMIS Web surgery, or whether it's a TPP surgery. If the functionality exists and they're able to receive that information, then a notification of that flu message being administered by the pharmacist will be sent to the patient's registered GP. So some fairly exciting work coming through, hopefully in the next month or two, in readiness for the flu vaccination. We feel it's important to ensure that we capture as many patients as possible, but also give the flexibility to the pharmacist to manage how many appointments are booked through the system. So you as a pharmacist, through the configuration side of patient access, have the ability to lock down how many appointments you want to have that day, and also the duration. So if you want to, and if your SOP states that you need to be doing a deep clean, which is probably the sensible thing to do between appointments, then you can manage that and put in some breaks between the various appointments, so that you can try and keep a safe environment in the pharmacy, but also continue to ensure that you're seeing patients in a safe manner, but not having too much interaction, because a lot of the information that we're trying to capture is done before the patient visits the pharmacy themselves. Okay, so this is where we see, in summary, where we're seeing the direction of travel, certainly preparing for the future. So we believe as EMIS Group that patient access is going to form a very important part of community pharmacies' role, whether it's booking appointments, whether it's capturing services, or whether it's looking at metrics about what services have been done in your area. We feel that's a really important tool and a useful module to drive new footfall into your pharmacy. We've obviously reviewed our technologies in light of COVID, and how we look to evolve the technology to ensure that it copes with the demand of any increased footfall that pharmacy have seen. We've also had a high uptake of pharmacy access, which obviously is the solution that connects ProScript Connect to EMIS Web. And we believe that by enhancing the capability of patient access, whether it's for NHS services or private services, we believe that will be an important way to proactively manage a community pharmacist's workload in order to cope with the demand of responsibilities, certainly from a service agenda. At that point now, I'm just going to pass you across to Jason, who will talk to you about smart pharmacies. Jason, over to you.
Great. Thank you, Chanel. So smart pharmacies, what does it mean? Well, we're trying to make bricks and mortar pharmacies, particularly our ProScript customers, digitally smart. Right, we know there's a number of digital players active today, in particular internet pharmacy. And what we've done is we took a step back and thought, okay, how can our ProScript customers deliver a great digital service to enable users and our patients to be able to be engaged in a very different way, a smart way. And what does smart mean? Smart means the ability for a patient to connect to one of our smart pharmacies, and that pharmacy not only to manage your meds, but to manage the convenience of being able to get those meds, but also introduce lots of other services that gives you choice to be able to avail of minor ailment service, the ability to be able to get your flu jab in September, the reminder to say, hey, we know you suffer from hay fever, our hay fever PGD goes live. And that's what this platform that we've built now is all about. It's about turning on all of our ProScript customers with this smart digital platform to enable them to be able to deliver a great digital service and frankly establish a new digital relationship with all of their customers. So I'm just going to walk you through what the UI is. So if you move on one, please, there, Chanel. So essentially you'd come into the application and we would introduce the concept of smart pharmacy. Now, in the background, what we've done is we've made sure that we've connected three core components: EMIS Web, Patient Access, and ProScript Connect. At the very beginning of the presentation, Chanel mentioned that one of the biggest problems is that pharmacies have not been able to order repeat meds for their users, and which means then that the only time they realize that the meds have been approved by the GP is when they pull it down from the spine. But before you did that in real time and it was real patient engagement. So what we've done is once a patient goes into patient access and asks for their repeat meds to be approved, the minute they are approved, we then send a signal, an attribute into ProScript, which then informs them that, in this case, Jason Keen's repeat prescription has just been approved, begin to prepare it. So when patients then log in to patient access, they will be, from a patient perspective, you log into patient access and we'll introduce the concept of smart pharmacy, which is number one, get status updates to understand where your meds are in terms of being prepared and so as they can be delivered to you either at home or click and collect. And there's a lot of talk about home delivery. Well, we did a research study of over the 500,000 users, and actually when we asked people which would you prefer, home delivery or click and collect, 68% said click and collect. But what people wanted was the ability to know when to go and pick those meds up, and that's what we focused on. And then finally, it's the ability to be able to connect with your pharmacist, the ability for the pharmacist to be able to send messages to that user so as they can tell them when to pick up their meds or when to come in for a meds review, or it's September, you're now eligible for a flu jab, would you like to come in? And what we've done here is we've made sure that we've made it a very, very simple user experience where users can pick which filters are really important to them so they can identify one of our smart pharmacies and then avail of that service. So move on one, please, there, Chanel. Notifications are critical, right? A lot of the research we did is, if you look at the ability, appointments are twice as likely to happen if you notify a user of that appointment. So we're making sure that we can notify the user and empower the pharmacy to be able also to notify the user for a number of things. It could be our platform informing a user about a medication reminder to be concordant with the repeat meds. It could be a simple message to say that your meds are ready, or simply checking that you're available to be able to come in with your appointment that afternoon. So next slide, please. Essentially, then, when you're in the application, that medication section is going to have 4 distinct sections. The first one is your active, right? That is the page that gives you a list of all of the repeat meds that you're on, and the ability to be able to ask your GP for approval to get another batch of those meds in one click, but also the ability to connect with your smart pharmacy and understand what are the things that are important between you and the pharmacy. How many open orders are there? What appointments have you booked? Are there any messages from your pharmacy? So then we move on to the next tab, please, Chanel. So now you're moving into orders, and this is a big focus of our technology, which is the ability to, if the user decides that home delivery is important to them, and that smart pharmacy, that ProScript pharmacy offers a home delivery service, then we can give the technology on the pharmacist side the ability to say, hey, your meds have been bagged, they're now out in the van and they'll be with you soon. Or even more importantly, because we know it's important to our users from the research we've done, giving them the ability to understand when is the right time to be able to come in and get your medication. No different for those, most of you on this call, I'm sure, have either used Just Eat or Deliveroo, and it tells you you've got your order. They tell you that they're preparing your food, and then your food is either ready to be delivered, it's on its way to your home, or it's ready for collection. Very similar model, but really trying to empower our ProScript pharmacy base to be able to have the digital tools to be able to compete in a digital age. So next slide, please, Chanel. Right, medical adherence, the third tab. We're putting a huge amount of effort into really trying to understand what can drive adherence. It's a hard nut to crack, and we're working with a number of partners to try and understand what is the right experience for users to be able to understand when they should be taking their medicine. But also not just simple alerts and reminders, because we can all get fatigued with those, but using UI and UX elements from other areas. I loathe to use the term gamification, but here what we're graphically representing is a very simple user interface to be able to inform the user how they are in terms of medical adherence. Are they being concordant so as they can catch up, and then ultimately for them to be able to realize that they're getting better outcomes. And then finally, the fourth tab, pharmacy. And this was a part that we know from speaking with a number of our ProScript customers, bringing medication and pharmacy services together. Right, the first 2 tabs were all about managing your orders and your medication. The third tab was about driving engagement and enabling the user to be adherent. And then the fourth tab is the ability to connect to your branded smart pharmacy. So as you can see, if there's any messages from that pharmacy, but more importantly, it gives the pharmacy the ability to be able to promote the relevant services at that time. We will also run campaigns. We saw there with Chanel, he was running through that process flow. We're already building for a really large flu campaign. We know that's going to be very different this year with the eligibility criteria to be extended, which means that there's going to be a lot more flu appointments, flu jab appointments going to be coming into community pharmacy. And we want to make sure that that's really easy for our users to be able to book and avail of that service. But it doesn't just have to be flu. When we launch this service, we would run campaigns. So we can, in our back end, we can tell how many users have got hay fever. These smart pharmacies are offering that PGD. We would then send out a campaign to all of those users and essentially drive that traffic into pharmacy. And that's what this is about. It's about not only enabling community pharmacy to be able to manage their existing customers, but this is about being able to drive those 10 million registered users, making them aware of all of the services that are available at their local smart pharmacy and being able to book them in one click, ultimately delivering brand new customers into our local community pharmacy network. We put a lot of thought and research into designing this, and it was interesting when we were planning for the services marketplace, and we were sitting down with a lot of independent pharmacies and just trying to get their view on services, and some are very, very bullish, some are a little slower to uptake. But what we couldn't, the conversation kept coming back to the fact that there needed to be a solution whereby pharmacies could help manage their patients with their medication, in particular around engagement and convenience. And that's what this solution does, but it also really nicely introduces patients to all of those services that you can get at your local pharmacy. And we're really excited to be launching this probably in the Q1 timeframe. And that is, I believe, my last slide, Chanel.
Jason, thank you very much. Really interesting stuff. And again, really privileged to be able to work, the team and I are able to work with you on developing smart pharmacy. I think it's a crucial stage for us to be able to promote some of these services. It's all about ring fencing the patient. It's about ensuring that you can provide the best services to your local community. So no, thank you for that. So to that end, I think it's important that rather than us sort of doing further presentations, we've got 15 minutes left, and we'll open the floor up to questions. So if you just bear with me, I'm just going to read through some of these questions, and then I will either answer it myself or get my lovely assistant to answer them for me as well. So just bear with me 1 second whilst I start looking at the tab. Just bear with me. Okay, so we have a question from Louise. What pharmacy services are available digitally? So in terms of services available digitally, we have quite a few PGDs as a starter for 10 that are on the marketplace service on patient access. So we have approximately 58 PGDs that are available through from travel vaccinations through to acne treatment and everything in between. And really, the services that you offer are dependent upon a couple of things. You may be offering you may already have a PGD provider, and you may be purchasing your PGDs through them, and you're able to, as a result of that, promote those services that you purchase through that provider onto the patient access app. We also have, as EMIS Group, a similar service, and through ProSup Connect, you're able to do, as I said, 58 odd PGDs, and they are available integrated as part of the solution. And we offer a full turnkey solution whereby we offer the training and accreditation part of the PGD. And once you've done that successfully and you've passed the assessment, it then releases the PGD onto ProSup Connect. And then at the point of where the superintendent has authorized that PGD and the pharmacist is accredited, then you can promote those services on the patient access app. So to answer your question, Louise, there are a number of services available. There could be things that you're offering which are not on that are not through EMIS. It could be, for example, COVID-19 antibody testing, taking venous sample in terms of blood. So there's a whole raft of things that you may be offering, and this gives you a good way to promote those services, because we know historically that simply the independent pharmacies are not so good at promoting the value they offer to their patients in their local community. So I hope that answers your question. How can you set up a pay pro ready for the flu season? Jason, do you want to take that one?
Certainly. Really, the simple answer is through our sales team. So what we can do is we'll at the end, when we are doing the roundup and we're going to answer any unanswered questions, we'll make sure that it's very, very clear how you can get in contact with our sales team. So 1, they can run a demo, and 2, get you up and running and ready for flu season. What I can say is that it's very, very easy to get set up. I mean, ultimately, it's a diary management system, albeit specifically designed for community pharmacy, but it's a very, very simple process. So we'll make sure that we distribute the details of how you can get in contact with one of our sales team to get a demo and get you set up.
Thanks, Jason. Hi, this is a question from Anonymous. Hi, Anonymous. What about non-EMIS patients such as System 1? I can answer that question, and I'll probably pass across to Jason as well to provide some further details. So Patient Access has approximately 10 million plus registered users. A significant increase in registrations have occurred post 23rd of March of this year in light of COVID. And prior to that, certainly a year ago, in fact, we opened up Patient Access so that you didn't have to be linked to an EMIS surgery in order to use Patient Access. So now, if you download the Patient Access app, it's open to anybody, and you can register with your email address and your password. So that allows us to get a significantly larger catchment area in terms of patients, and that's partly driven by why we've got such a large footfall of patients registered through the app. But that does open up a significant number of other opportunities. So if a patient is part of System 1, and Jason will go into a bit more detail, that really gives us some good leverage into smart pharmacies and how patients are requesting their repeat. So do you just want to talk about that, Jason, a bit more, so that
yeah, so let's take a look at the question, which was specific around TPP and System 1. So two parts. Chanel alluded to the fact that anybody can sign up for Patient Access, right? So you can sign up for Patient Access today and book a pharmacy service without linking to your GP practice, right? So anybody can do that, whether EMIS or TPP. And we get about 150,000 to 200,000 users signing up a month. On a monthly basis. They're called untethered users. Then when they sign up, they're given the option to be able to link to their practice. So the ability to link to your practice is obviously only available to EMIS practices today. But what I can say is that we are currently working with TPP to integrate with their service, which means that all of our users, whether TPP or EMIS, will be able to link to their practice and essentially book pharmacy services. The other piece that we'll have in the application is NHS login, which means that anybody who does come in from the internet, what I mean by those 150,000 users we get on a month, tend to be coming in from Google traffic. So if you put in online GP appointments or online prescriptions into Google right now, you'll see that we rank, top 3 in nearly all cases. So when those users come through to Patient Access, if you are, first of all, untethered, you come in, you can book a pharmacy appointment, including flu, straight away. But then you have a choice to link to either your EMIS or TPP practice. And you can do that using NHS login. So the TPP integration and the NHS login to make that a seamless digital experience will all be live before the end of the year.
Jason, thank you very much. Okay, I'm going to tackle 2 questions into one because I think I can provide an answer for both. So that's from Lynn Gathercole, which is any thoughts on connecting farm outcomes and primary care pharmacies up to secondary care, EMIS pharmacy systems? And a similar question from Julian Wynn. Hi, Julian. How do you envisage the working relationship between hospitals and community pharmacies to be enhanced by technology over the next couple of years? So farm outcomes plays a really important part in answering both those questions. So you may be aware through the CPCF announcement back in October last year, there is a new discharge medicine service taking effect. It should have been taking effect from, I believe it's from July or October of this year. It may well be delayed because of what's been going on, but certainly the discharge medicine service is a really important service which effectively replaces the MUR, the medical use review, because they're being carried out by pharmacists in general practice. But that service is an important service for pharmacy, but we believe we have the technology already to provide the conduit between secondary care and community pharmacy. So we already have farm outcomes at the moment that is able to send a message from a hospital pharmacy system to a community pharmacy, and that information will provide you with effectively as a discharge medicine message or a TCAM message, transfer of care medicine message, and that will provide some information about what meds the patient has been discharged on, and that will then instigate the review. So if you recall, I said to you earlier on in the presentation, there is a significant integration roadmap with Farm Outcomes and ProScript Connect, and the discharge medicine service will play a significant part in that, because again, we want to be able to support our pharmacies in offering that service and being able to do that service streamline and through the system rather than coming out of various systems to offer the service. So we've already got the building blocks there between secondary care and community pharmacy. And I think that Pharma Outcomes being part of Prospect Connect will able to provide a much better user flow and journey for pharmacies to capture that data. Where do I see the relationship? Where do I see the relationship going forward? Well, at the moment, certainly through this new forthcoming service, it's one way. But I'm a strong advocate of ensuring that community pharmacy plays a big part in the medicines reconciliation of medicines as well. So it's all well and good a patient we getting notified, or community pharmacy getting notified that a medicine has come out for medicine's been changed or has come from hospital for that particular patient. But equally, we want to make sure that we are providing a safe service at the initial entry of that patient into A&E or into hospital. So we want to be able to contribute to the medicine reconciliation task that's done by hospital pharmacy, so that it contains community pharmacy information as well, but not just ethical medicines, so your prescription medicines, but also over the counter drugs as well. So we do know that over the counter drugs that are taken by patients can contribute to hospital admissions, and we want to be able to provide that information, whether it's through patient access or whether it's through sharing agreements with Prospect Connect, but being able to provide that information to a hospital so that they can provide a much more safer and better service. So that's where I see the direction of travel and working closer together. And in fact, I'm joining another session next week with my acute colleagues about how we can drive a better relationship between hospital and community pharmacy. So I hope that answers your question, Lynn and Julian. Okay, another question from Simon. Really interesting session, thanks. Will the slides be shared? Do you know when SCR will be available in Prospect Connect? So Simon, thank you very much for your feedback, it's really appreciated. Summary care record, in fact, is already available at the moment. So I presume you're referring to summary care record, the service that we've got available through Pharma Outcomes. If not, then apologies if I misunderstood, but the service is already there. We're currently rolling out and have rolled out to a significant proportion of the estate. In support of the pandemic delivery service and the activity that's required there. So it's already there. If you want to drop me an email or send me an email a bit later on, I can check whether your pharmacy, if you are a Prospect pharmacy, if you have been enabled, and confirm back to you. So hopefully that answers your question. I'm just going to check if there's any more. We've got another five minutes or so left. So let me just check if there's any more new questions. There is. It's a topic of commercials. So I'm going to be. Let's publish this question. So we have an anonymous question, which is, how much does this cost? It looks really promising. So Jason, over to you.
That's if the question is specifically around patient access for professionals. Listen, obviously there is a cost. The current model is there's a listing fee. So for you to be able to avail of the PA Pro software, the license, and then list all of your services in patient access, that is a £50 listing fee per month. And then on NHS, there's zero take. And on any private services, we take 15% of the RRP for that service. So that is the rate card as it stands today. But we, when we can understand what your needs are and the scale that you have, the sales team can essentially put a package together that suits your needs.
Thanks, Jason. Okay, we have a question around metrics, and this is a question from Sean. What percentage increases have you seen in digital registration over the lockdown period, and is that continuing? In summary, the move to digital, is it accelerating? Jason, do you want to take that one?
Yeah, I mean, we saw unbelievable numbers, particularly in March. To give you an idea, patient.info normally does about between 6 and 7 million users, and that's people reading content. We did 10 million users. In April, we also broke through 10 million registered users for patient access. So the demand was really, really, really high. In April alone, we normally do about 1.4, 1.5 million repeat requests on a monthly basis. In April, we did 2.5 million. So we saw, I think in April we had about 375,000 users sign up for the application compared to a normal month, which is anywhere between 150,000 and 200,000. That trend has not been sustained, as you'd imagine. There was obviously a rush on people needing their meds. There was a rush on people needing a digital solution to be able to contact their practice. But what we have seen, even though the trend has kind of come back down to normal levels, we have if I look at that linear trend going forward, clearly people are very pleased with the service, and our general growth rate is continued to grow.
Yes, and what's interesting is in terms of the services that have been going through from a pharmacy perspective through the patient access app in terms of metrics. It's very difficult to understand the private market in relation to metrics and patients registering for these types of services. But what we have seen is certainly that weight loss, erectile dysfunction, and emergency hormonal contraception and the asthma inhaler PGDs were the most commonly utilized services that were being provided to patients through PGDs last year. Obviously, when flu kicked in last year, that sort of put that at the #1 position. But we are getting some interesting metrics around what patients are searching for. So by having a significant cohort of patients and registered patients through the app, we can then start to understand what patients' thinking is in and around healthcare and the services that they are searching for. Okay, the time is now 2 minutes to 8. I think we'll close it there. But before I do, I just wanted to thank the audience for attending this session. I appreciate it's out of your time in the evening. I know you've had a busy day in the pharmacy, no doubt. So I thank you for your time, and I'm sure Jason does as well. I also want to thank Jason as well for supporting me in this presentation today. I really hope you found it useful. If there are any questions that you have after this session, then my contact details are available, I believe, through the website. And I'm happy to answer any questions for you that haven't been discussed or published for review here. So thank you once again. Have a great evening, and I wish you all the best. Thanks very much.
Thank you, everybody.